to this one. All right. We are broadcasting. All right. Very nice. Well, welcome to all of you. And I think our attendees are probably coming in. We are here at the webinar hosted by the Illinois Muslim Civic Coalition. I'm Maryam. I'm the Director for Advocacy and Policy here. And for those other people that are watching and people that are on the panel also know that I am very passionate about legislative responses and solutions to community problems. I want to thank all of my panelists, and I would like to introduce them shortly. I do want to say the reason why we're having this conversation is because COVID-19 impacts every aspect of our community. It's a global phenomenon. I call it a phenomenon. And in addition to that, there are individuals that have been given resources to be able to self-isolate, to have shelter, to protect themselves. And we are following those orders around the country. I do want to, though, highlight, and why this conversation is so important, is that many people don't have that option. A lot of people don't have the option to self-isolate based on where they are located and what they are experiencing. So with that, we are going to discuss Illinois prisons and the role of COVID-19. And I'd like to start off with introductions. Joby, please go ahead.
Sure. Joby Cates. I'm Executive Director of Restore Justice Foundation and Restore Justice Illinois. We're one organization which has two parts, or one group of people with two parts. And our mission is to roll back some of the most extreme tough on crime policies of the 70s, 80s, and 90s. And our focus is on people serving extremely long criminal sentences for things they did when they were young. We work with family members, we work with formerly incarcerated people, we work with people inside Illinois prisons. And when the COVID-19 outbreak started, we were able to stop everything and focus all of our attention on trying to serve and protect the people who are inside Illinois prisons throughout the pandemic.
Thank you. Thank you, Joby. Dr. Maryam Hussein? I think you're on mute. I think you're on mute right now.
Yes, I am on mute. Thank you. Well, thanks for having me as well, too. My name is Maryam Hussein. I'm a physician in Columbus, Ohio. I'm also the Vice President of IMANA, which is the Islamic Medical Association of North America. And so I'm a part of this conversation just because as COVID-19 is such a significant public health issue, IMANA has been responding to this pandemic along with several national Muslim organizations focused on public health. And so I'm happy to provide some insight onto the health aspects of this.
Thank you. Nasir, and I think you're on mute as well.
Yes, my name is Michael Nasir Blackwell. I'm a criminal justice organizer with the Inner City Muslim Action Network. Iman has been addressing this self-quarantine pandemic by pretty much handing out food to the seniors, as well as addressing the community at large. We have a walk-up every Thursday at 9 a.m. And I personally drive to the seniors' homes, practicing social distancing. Unless they need assistance, if they're immobile, I'll try to bring the bags up to their front doors. And if they open the door, they'll walk into the living room, and then I'll leave the bags within the doors, and then I'll leave. And we are able to hand out, so far we've been able to hand out over 500 bags of food every single week. It's very difficult with the incarcerated population because their families are in constant contact with me, trying to figure out how to mitigate the problems with the men and women inside the prison system, as well as in Cook County Jail. People coming home are being placed on home monitoring, electronic detention, and they only receiving 12 hours movement a day. It's very, very difficult for them. It's very difficult for them to continue to self-quarantine while they still have to earn a living as well.
Thank you. Thank you. I think that's a good introduction to kind of the different angles of what all three of you represent as far as COVID-19 is concerned. So I want to thank you for that. Also for everyone joining us that is observing Ramadan Mubarak to you. That's 30 days of fasting from dawn till sunset. And definitely the highest accruement of blessings can occur as we amplify charity and help those that have less than us. So this conversation is so crucial to every faith that believes in helping the less fortunate. So Joby, if you can tell us from your experience, the unique situation that COVID has created for your work and the people that you serve.
Thank you, Maria, and thanks for organizing this. And I really appreciate the opportunity to get to talk about this issue. It's a difficult one. So just a little bit of, by way of background, Illinois has about 30 right now, maybe under 37,000, slightly under 37,000 people who are incarcerated in facilities across the state of Illinois, correctional centers. And in those facilities, there are also thousands and thousands of staff members who are public employees who are correctional officers. And many of these communities are not in the Chicago area. So they're not right in front of our eyes. The closest, I think, to us is Stateville Correctional Center in Joliet, to those of us who are in the Chicago area. So there's a bit of an out of sight, out of mind that's always been the case with prison. People from Cook County are shipped out to all across the state to smaller communities, more rural communities, and we don't see them again until they come back. And then Nasir and his incredible organization welcome them home. The vast majority of people in Illinois prisons do come home. They serve their time and they come home. But about half of the people in Illinois prisons are what we would call, or what most people, other people, not me, would call violent offenders. So why don't I call them violent offenders? I don't call them violent offenders because they're people who were convicted of a crime that the state of Illinois considers violent. And the state of Illinois considers a lot of things violent that aren't actual violent acts. They also, our state law is extreme when it comes to length of sentences and inability to earn release for people with so-called violent offenses. So if we've got these 37,000 or so people, we've got half of them, a full half, are in this category that no one does anything for. You never hear legislators saying, you know what, I think we need to do something nice for violent offenders. Just doesn't, it's not a very popular position. But if you get into it and you start understanding who these folks are, they're not violent human beings. They're people who either situationally were part of violence young. They're probably a category that have violent proclivities. I would imagine a very small category. And then there are a number who literally never did anything violent, but Illinois law is so vague and so broad that they've been convicted, not to mention the wrongfully convicted, which Illinois is full of. So when COVID-19 hits, out of sight, out of mind, lots of people in the prisons who are not eligible for sympathy and mercy by the press, by local elected officials, and indeed, in some cases, by state officials. Although I think our governor has done a fair job of, especially in his clemencies recently, in trying to show mercy and release people who are at the end of very long sentences. So our role, I'll be real quick and wrap up my part here. Our role during this crisis has been twofold. One has been advocacy around early release. We were probably March 6th, 7th, 8th, we started drafting op-eds and advocacy messages to legislators and the governor, literally begging them to start an early release process because we saw the writing on the wall at Rikers, actually in New York, which is a jail, but it was a similar type of environment, begging them to let people out because we know prisons are overcrowded, and we also know that Illinois prisons have a terrible track record of providing healthcare on a good day. Yeah. On a good day, we don't provide healthcare for our incarcerated individuals. So we have doctors and nurses already who know they can't handle what they've got say at Menard Correctional Center downstate, which is one of the largest maximum security facility in the state. So that's number one, let some people out. However you define it, however you want to do it, let some people out, take the pressure off the numbers in those facilities, congregate settings as they're being called now. Then the second part has been around prison conditions. We've been very, very concerned, particularly outside of the Chicago area where people are pretty scared by the numbers they see, that in towns downstate where they might not be seeing as many cases, that they might not take the rules as seriously. Correctional officers and others might be going to work without, if they're given PPE, they might not be wearing it. So we started something called a tracker, where we started taking all the relationships we have with men and women inside, mostly men, and all of the friends and family relationships we have around the state with people who have loved ones who are incarcerated. And we started tracking our conversations and reporting to IDOC and to reporters and on social media what we were hearing. And in the beginning, for example, we were hearing that people weren't getting soap, they weren't getting supplies to clean their cells, they weren't able to go to commissary to buy the things they needed to clean their cells. When they finally did start getting some of those supplies, we started hearing new things. They're not getting their inhalers, they're not getting their regular medical care or supplies. Now we're on lockdowns, which for us means something very different than for them. Our lockdown is a lot nicer than their lockdown. Some of the men, for example, at Hill Correctional Center right now have gone on a brief hunger strike to try to get better care and better access to supplies. So we think that the Department of Corrections has done, they have a very hard job. And I think they're starting to take seriously their obligation to be transparent. But we're still, I think our biggest challenge now is trying to get them to be more transparent. There have been more than 10 deaths at Stateville. There have been more than 180 cases at Stateville among inmates that we know about, and over 100 cases among staff at Stateville. And one thing I'll just close with is the virus doesn't know the difference between an inmate and a guard. The virus doesn't know the difference between the guard's family and the inmate's cellmate. The virus doesn't care. And these whole communities are at risk when there's a vector, a super vector, as they're calling it, starting in a prison or a jail. So we're very concerned about transparency right now, and the fact that testing has not been as widespread as we'd like in the prison community. So I'll stop there. I talked too long, I'm sorry, but that's our little intro of what we're up to.
No, that's great. Thank you so much. And thank you for being so thorough. You said quite a few powerful things that I'm actually going to come back to after we hear from the other panelists. But I think the biggest thing is that at the end of the day, this is a community that's already not been given the basic needs of healthcare. And so this is amplified. Dr. Maryam, if you could weigh in from your perspective on proximity, crowded areas, and just the virus and how it operates.
Yeah, absolutely. Let me make sure I'm not on mute, right? Okay, perfect. So yeah, that's a great segue into that. So I think just a quick background on it. So COVID-19 basically just stands for a new type of coronavirus that no one has seen before. And it just so happens that it occurred in the year 2019, so just last year. So it doesn't mean that there have been 18 different versions of this. That's just the name that it was called. So because of that, to help remind people that it's a coronavirus, so it's not the flu. So I just really want to make that very clear that this is not like anything we've seen before. And so the reason is because we don't know a lot about it. And that's probably one of the other things too, why this has become such a problem, is because it doesn't act like other viruses that we're familiar with. So for example, with the flu, if you have the flu and you're in close contact with someone, the risk of you transferring it to someone is 1-to-1, roughly. But then when it comes to this coronavirus, there is a certain epidemiological characteristic that they apply to all these viruses. And whereas the flu is 1-to-1, in the coronavirus's case, it can be up to 1-to-3, if not 1-to-4. So that's the issue, is that this close proximity that you're talking about is that it's not so much that the one person you're going to affect, but the multiple people you're going to infect. And so how is it spread? So basically what we know now, at least, a little more than a month into all of this, is that it's roughly by droplets. So if you cough or sneeze and you don't wash your hands, anywhere where your cough and sneeze will fall onto, whether that's some other person or your clothes or the desk, the doorknob, that is how people can pick it up. So even though the risk factor right now that we're seeing is 1 to 4, it could become exponentially bigger depending on everywhere that you're coughing and sneezing and not washing your hands and all the people that you're interacting with. So that's why these measures of social distancing are so important, and why most states have enacted this, is that we need to just literally physically separate from each other so that we can decrease that spread when someone coughs or sneezes or hacks up, something like that. When it comes to, community type issue, I think what COVID-19 has done is that it's really highlighted what already exists in a healthcare perspective in the country, and it's just amplified it for all of us, or magnified it, I should say. So we're seeing a lot that I really appreciated what Joby was talking about, that the virus doesn't care who you are exactly. But what's sad is that even though the virus doesn't care socially, we're seeing a lot of health disparities related to coronavirus, where a lot of Black and Brown communities are disproportionately being affected by this virus compared to other communities. And so when you talk about the prison population throughout the country as well too, that disproportionately you have a lot more Black and Brown inmates, whereas the crime rate itself is pretty even keel around the different races. So we are obviously society-wide, we have a lot of disparities, and what coronavirus is showing is that again, it's just magnifying those concerns. So it's very distressing for healthcare providers themselves, because we're obviously in close contact with patients as well. And when you don't have enough personal protective equipment or PPE, you're just as likely to get the virus as anybody else. So the other problem too that I just want to point out as well is that there's asymptomatic spread. So that basically means is that you can get the virus and not even know. You won't have symptoms. And that's why a majority of people actually do well, which is great, right? Almost around 80% of people or so do well who are infected. The problem is that, again, it may not be the individual health, but the community health around it. So again, you can see that when you talk about close quarters, like we were just discussing, especially let's say in a prison environment, it is extremely likely that if one person has the virus, then multiple people can get infected. And the worst part is that you wouldn't know. So to wrap up my part just real quick, is that the things that I think we really need to focus on because of this is that we need increased testing. So people who will show symptoms and people who don't, because we are basically running blind or operating blind right now. We don't know who has it, who doesn't. So that can help a lot to know who needs to be quarantined, who's at risk, et cetera. The other thing is that we really need more personal protective equipment. Exactly like Joby had mentioned that, you're seeing cases obviously with public employees in the prison systems, like the officers, and then also the inmates themselves. And that, again, like I said, because it's respiratory droplets, so when you cough or sneeze, if you can block those with a mask, that obviously helps a lot as well too. And really, I cannot emphasize enough, because we don't have a vaccine, because we will not have a vaccine for quite a long time, because we have to do clinical trials, and there is no medication. There's no antibiotic yet. There's nothing else that we know is going to work against this virus. We have to social distance in order to flatten that curve so we don't overwhelm the hospital systems, so we don't overwhelm the prison systems with more incidences amongst inmates and officers as well too.
Sorry, I apologize. So thank you so much. I think also, and I'll get back to a couple of things that you stated, is that you have a general description of what we're facing as a country as a whole, but then things are amplified from within the prisons, and then further amplified when you talk about health disparities and specific communities. So this is where we see like the chain, right? We see the chain of a phenomenon that impacts everybody, but the access to healthcare is really divided up community race by race almost, which is a whole different dimension to talk about. So thank you so much. Nasir, let's talk to you about your community members that you're working with, that you're seeing. You touched upon it a little bit in your intro, but let's talk about a little bit about the mental and emotional health of the situation and how family members are responding with people that are inside.
Wow, man, y'all brought up so many valid points. It's very difficult. The family members is I want to say, for lack of better words, it's like pulling their hair out because you can't visit your loved one any longer. There's no way to do FaceTime because it is a major rules infraction. If an individual, we have no access inside other than someone bringing a phone to your cell, or if a correction officer allow you outside your cell to gain access to the phone within the cell house area, because people are confined within a 10-foot by 12-foot cell with another individual. And then when you're talking about maximum security prisons, it's even smaller. It's 6-foot by 9-foot cells. And even in instances of Menard, they're 5-foot by 7-foot cells. We're talking about very small confined quarters, individuals. And then if an individual is sick, they have to submit a request to healthcare, or they have to get a hold to a correction officer to give that correction officer a healthcare request slip, just to get someone from healthcare to come to the cell house to that cell. So it's very difficult for families because, one, they can't assist their loved one incarcerated, and then the loved one incarcerated can't receive access to healthcare that they need. You're confined in a 10-foot by 12-foot box, literally. You have no access to the outside world but a correction officer. How can we mitigate that?
So thank you, Nasir. I think it's very easy for policymakers, legislators to see this, and even for healthcare workers that are outside, that are in specific areas serving certain communities, to see this from far away, from a bird's eye view. And so I think it is so invaluable to be able to really feel the pulse of what it means to be on the ground on this. I want to get back to a couple of things that Joby stated. So Joby, before we even talk about solutions and getting actively engaged, getting citizens engaged to be able to care about this issue, we really need to counter and confront the narrative of why should we care? Because you briefly stated, that Illinois state law defines a lot of things as violence. A lot of these people have backgrounds that come from a violent background, but you don't consider them violent offenders. You consider them people. And I'm assuming because you've gotten to know them and you know their circumstances. And how do we as a society, to be able to confront this, be able to see that commonness and shared values as humans that we have on the outside of that prison cell and that jail to the person that's inside in a time of a phenomenon?
That's a huge and very difficult question to answer. But I would argue that a lot of it is just about actually paying attention to what's in the law and what isn't. When I started doing work around criminal justice, legal, I'll have to call it criminal legal reform, there really is no justice in our criminal law system anymore from my point of view. When I started doing this work, I started meeting family members of people who were incarcerated, and then I started visiting prisons. And I kept waiting to meet an individual who scared me. I would go with my children at the time when I started visiting inmates, when I started visiting men who were incarcerated in maximum security prisons, who had quote unquote violent offenses. My kids were 5 and 11. And I've never yet met a man in a maximum security facility who has even given me a blip of fear. I felt fear in the waiting room. I felt fear around some of the officers, not all. I felt viscerally that this was wrong, that these were not inherently violent human beings. And everybody can't do that. Everybody can't pick up and start, it was part of my job. So everybody can't pick up and start visiting people in prison one-on-one. But people can start paying attention. I think it's really hard if you're an active consumer of news and media now to ignore the fact that most of the major reform organizations in the country are talking about this way. I'm not unique. There are a lot of people out there talking about these issues this way. There are numerous released people who've made incredible strides in changing the narrative. I think what the crisis has done is it set us back a little because it made categories really important again. And I don't know if Maryam and Nasir agree with me on this, but when we have a huge crisis and you're dealing with thousands and thousands of people, the temptation is to start putting people in categories. Well, who are people with comorbidities? Who are the people with, over the age of 55, or who are the people who are most likely to whatever? And what happened with calls for early release was, well, we can only release nonviolent people. Okay, well, the only way to define nonviolent in a bureaucracy is to count them based on their offense. And those offenses are meaningless in some cases, really, quite meaningless as to the level of violence a person has actually even participated in. So that's one piece of that issue. And so then what we're finding is that during this crisis, a lot of folks who might fit this criteria of nonviolent are people who are serving shorter sentences to begin with. The good news is a lot of them do have a home to go to because they haven't been gone that long. But the bad news is a lot of them didn't have a life outside of the activity that got them arrested. So if their life was retail theft or their life was dealing in drugs, that is a very hard thing to break. It's a different thing to break than somebody who's done 30 years for an offense when they were 18, who's been working as an electrician inside a prison their whole life and has absolutely no experience living based on retail theft or based on drug sales or whatever. So we're looking at a lot of the younger guys getting out who still have they're a little feisty. And the guys who've done a lot of time, who've really matured and grown up in prison and who are really rehabilitated aren't getting a shot. Mm-hmm. And those are the guys who, I've hired 2 men who did more than 25 years in the Illinois Department of Corrections, and they're the 2 best hires I've had and made in my almost 30-year career. They're responsible, they're thoughtful, they're grown up, they've dealt with themselves, they're human beings. They're human beings who grew up. Mm-hmm. So I'll stop there and say this is a huge challenge that I think more people need to get out, period, during this crisis. And there are very few people, I think, who are truly a danger to society by their very presence in it that we have locked up in Illinois prisons.
So,
Joby, I just want to chime in real quick because you brought up a valid point. Because I served 24 and a half years for a triple homicide. And what's ironic about this is these are isolated incidences. When they say violent offense,
that's right.
What they fail to allude to the public is these are isolated incidences. And this is why they are on the low end of the mean curve on recidivism. And of course it has a lot to do with the length of incarceration. But because of these isolated incidences, the likelihood of them repeating themselves is zero to none. Zero. I mean, it's very, very limited. It's because of the amount of harm and pain these isolated incidences cause why these individuals, and such as myself, receive such lengthy sentences. And another thing, what people does not talk about is individuals that receive these types of sentences. A lot of them are what we call is not co-conspirators. They just happen to be
co-defendants.
That's right.
Co-defendants, yes.
Yeah.
That's right.
You have individuals serving 30 years that didn't even commit the offense, didn't even kill anyone, didn't even put a hand or harm a hair on anyone's head. And we're not talking about these people, and we changed the narrative. Narrative is very important. We don't say violent offenders, we say returning citizens. You see, we changed the narrative because narrative is very important.
Yeah, I mean, thank you for that, Nasir. I think that's why it was so important. I think we have to get to the heart of the matter on this, because if we're going to advocate on behalf of a community in any way, so many people are so ignorant, and I don't say by choice. There's media and there's a lot of different things that spin this about who we're actually talking about, and I think that goes into violent circumstances in the home, cycles of violence, right? Proximity to crime around them where they cannot escape, poor education systems, prison to pipeline, right? From school to prisons, mental health. I mean, these individuals need to be in rehab centers and not in prisons. And now we're in this situation. And this is why COVID, to analyze this in this environment, is so significant, because it started way before the phenomenon started, but the way it impacts these individuals in every aspect of society is much worse than everybody else. And I think we need to always remind ourselves that we're not the judge and the jury, right? We're not in that courtroom. So these individuals, we don't play judge and jury. We are part of a community and a society, and there's people that are trapped in there for different circumstances, for crimes they did not commit, or were just happened to be there, were wrongly accused. And I think what's powerful is, earlier this year, we had a discussion, Nasir, you were part of this discussion, where we talked about the movie When They See Us and Central Park 5. And a lot of people were surprised. You're like, this actually happened. And well, it's not in the past. This is still happening. So, Maryam, I'd like to turn to you now to kind of talk to you about your obligation as a physician. And I know that we had a brief discussion about sometimes people feel resistance or conflict of how to talk about healthcare to people that are considered offenders, and how, as a physician, you view your obligation. And if you yourself find yourself, and maybe the physicians you work with, or the training or the institutions, have you ever felt that the medical society put people in categories?
Yeah, no, that's a great question. So it's a really good point, because we almost by default put people into categories, right? More so based on diagnoses, I feel like. So if you're someone who has COPD or cancer or diabetes or something, so you're naturally, to your point, Joby and Maria, that we naturally do put people into categories. I think the problem is that when those categories start taking on judgment, like you were saying, that we're not the judge and jury, but that if you're diabetic, that, oh, well, you did this to yourself because you ate or something. And if you're COPD and cancer, like you smoked, and so that's what happened. And so slowly these things infiltrate, right? And so whenever you have, when it comes to a prisoner population that comes in, obviously the automatic thing always goes to, right? But to be totally honest, you always think it's some violent offense, they did something wrong, they're not good people, their mom was bad, something like that. And, to what people were talking about earlier, is that honestly, and this is anecdotal, obviously, but whenever my friends or physicians are taking care of prisoner populations, they always comment how they're just the nicest people. You'll have your random one or two, that are rude, but they're very appreciative. They don't take a lot of your time, wasting your time with different things. And so they're just always appreciative of the care that you get. And so I think it is very important, because when we take our Hippocratic oaths and, when we are supposed to interact with patients, there are three main principles that we're supposed to follow. It's like the Belmont principles that came up, after Nuremberg and everything, is that, respect for the person, beneficence, and justice, right? And for a healthcare provider, the one benefit I think that we have is that we don't have to do the justice part, right? We don't have to be the judge and jury. We're not in that courtroom saying that, oh, we should litigate you for what you've done. Everyone is supposed to be that, hey, you're the person who has this problem, and I will do this to help take care of you. The thing that gets into that makes it very difficult, and I think why these issues of othering people and categorizing people, is that we're limited based on the system as to how much we can do for people who are prisoners. And so in terms of even the medications, right? Every state is different as to what their formulary is in their pharmacy. So we're restricted in times as to what medications we can give. Follow-up care is very difficult. I know with COVID, everything is going telehealth, telemedicine, but for years now, telemedicine has been happening in when you're taking care of prisoners, for example. And so there's obviously that there's been that precedent there before too. So it's basically to say that, you know, physicians are obviously humans too, and obviously we have our own implicit biases as well. But I think it's one of those things where we really need to talk about implicit biases more, and to make sure that, you know, if we're the providers that are not supposed to litigate, right, and to treat people equally, then maybe having part of our voice to help, right, bring more awareness to these issues, that there are poor health conditions going on in prison systems, and that people are by default being othered based on, you know, one bad mistake, let's say, for example, or because you were black or brown, right, and you were in the wrong place at the wrong time. That is something that we should probably be speaking up a little bit more about, I think.
So, Maryam, you know, one thing you stated right now is that when you took your oath as a physician, right, and you took this oath to treat everybody fairly and to provide care. What's interesting, Joby and Nasir, is when I hear that, is that even though we're not physicians, we're still citizens, right, of a community. Like, what does that oath mean for us, right? Does it mean to just pay our taxes and not break the law? I mean, what does that really mean? Like, every one of us has a capacity of what we take an oath for, of how we interact with other people and the people we serve. And for many people who are not in such a profession, they are still interacting and judging and assuming, and are they empowering or not the communities that need empowering? So I think that was just very interesting. Some people have a concrete oath that guides them. And then there's those of us who actually should have that implicit compass because of just being human and walking the same streets that other people can't walk. For personal circumstances, due to personal circumstances. Nasir, you spoke a little bit about, before we started the broadcast, about people that have the sensors attached to them now, the people that are released. Can you talk a little bit about that and just your experience with that?
Yeah, right now there's a movement in regards to electronic monitoring. The Department of Corrections has the authority to issue electronic detention on people coming home. Unfortunately, that focus has been on violent offenders. By default, it's like default, they just automatically assume your risk. And the Department of Correction are starting to use these risk assessment tools, or what we call the RAT tools, with these models based upon violent offenses. And these models are very poorly they're very poorly used. Individuals within the Department of Corrections, for lengthy periods of time, when they receive their assessments, their assessments is based upon offense only. Unfortunately, the individuals that's conducting these assessments isn't even trained properly. I'll give you a brief example. When I was assessed, right before I came home, the prisoner review board individual that assessed me only had 2 sentences in front of them on a piece of paper. On 24 years, mind you, of incarceration, 2 sentences on 8.5 by 11 piece of paper. That was so unfortunate when I never served 1 day in segregation the entire time of my incarceration. I studied law the entire time of my incarceration, right? I was an advocate the entire time of my incarceration. I earned over 126 college credit hours my entire time of my incarceration. I helped form programs. I was a founder of a veterans organization. None of these things was in front of the individual that was assessing me prior to I came home, and he told me that I needed to do 60 days of electronic detention. And when I inquired why, he said, because of my conviction. And I said, but I never served a day in segregation. I said, that is unheard of. You know how hard that is? but he assessed me based on my offense.
Your category.
Yeah, the category of my offense.
Mhm.
I received electronic detention because of my offense, not because of my conduct within the Department of Corrections. And that's so unfortunate. And Joby, you brought up a valid point when individuals that the governor is saying, well, you know, we need to start releasing individuals because of this this coronavirus. We cannot release violent offenders. And I don't understand why, when I'm a violent offender, technically, I mean, that's how you can define me as such. Moreover, a lot of people don't even know I served 4.5 years on death row. How many people know that? And here I am on the streets, I'm at home. When people meet me every single day, they don't even know that I was on death row. They don't even know that. And then when they find out, they become horrified. And Dr. Maryam, you brought up a valid point. I had a doctor actually tell me I was a bad person. Yes, when I came home, when I was trying to find my personal care provider, and I was meeting a lot of doctors, and it was a Muslim doctor, and that's why I chose him. And I immediately dropped him because once he found out that I had a violent offense, he didn't want to deal with me. He told me that I was a bad person, and he didn't even get a chance to meet me. He didn't get a chance to know who I am. He told me I was a bad person. Yeah, because of my violent offense.
I mean, I think it's fair to say that Nasir, your experience is not unique. And one of the things that I've looked to a lot over the past few weeks when I'm trying to be reasonable and be measured as an advocate, you want to make a difference. You want the governor to agree with your recommendations. You want legislators to work on legislation that you believe in. And so you try, for me, I try to be reasonable. I try to be, just the facts. I try not to be emotional. Mm-hmm. And one of the things I've been bringing up again and again is that the Illinois Department of Corrections has been sued and lost on the state of its healthcare and is forced to undergo a review. And every 2 years, I think it is, there's a big report that comes out. And in the 2018 report that came out, I think October, November of 2018 to the court, a court-ordered report, the researchers found that 2 of the 3 deaths that they examined inside IDOC facilities were preventable. Mm-hmm. 2 of 3. And as we look at some of the situations in different facilities where at Menard, where I'm assuming you did a little bit of time at Menard if you were in for that long, Nasir, where men are being asked to volunteer to care for the elderly inside elderly incarcerated people. Younger, more fit men who are also incarcerated asked to volunteer because they don't have the staff to care for the men who are sick. And in the reports, the most recent report that came out, this court order report, said that the infirmaries, before COVID, before coronavirus, that the infirmaries in some of these facilities were chaotic, short-staffed, basically people delirious, people there, incarcerated people who had a range of very serious conditions who were absolutely it was a unthinkable situation that the reporters discovered when the researchers discovered when they went to make this report. And the truth is, I think this goes back to Maria's earlier point, and really all of our point, is that we have to care about human beings in order to care about people who are incarcerated. We have to believe that everybody's human and we're all part of this together. And one of the things I have found that's just a reality is that there's a segment of our culture, of our society nationally, maybe globally, I don't know. But I've run into it in both political parties, both genders. But there's a school of thought out there that if you make a mistake, if you step a toe out of line, you deserve what you get. And anything that happens to you after that, no matter how extreme, well, you did that thing. So, and it's unthinkable to me. It's just not part of it's not how I was raised. It's not, my mom wouldn't, who I think is listening right now, my mom would not be happy if she thought that I was being that merciless. But it is part of our culture. And we see it in immigration, you guys, we see it in all sorts of different walks of life. So I think combating that is difficult, which is one of the reasons why we try to get really tactical. You know, we're asking the governor right now, okay, governor, you're reporting every single test that you're administering in long-term care facilities, congregate settings that are in the state of Illinois. So the public can make informed decisions about what's going on with their loved ones in long-term care facilities. Why aren't you reporting testing numbers in prisons? Why not? It's a congregate setting, it's in state control. Right. Let's see, how many people are you testing? We know that there were many tests at Stateville because there was a serious outbreak there, but on the website in the Illinois Department of Corrections at Hill Correctional Center, there have been the same 3, 4, 5 cases, tests listed there, cases, not tests, for more than 2 weeks, maybe 2.5. Now we know how the virus works, right? And Maryam, you can hold me accountable if I'm wrong about this, but typically in a congregate setting where people are touching each other all the time and there isn't enough stuff to keep the space clean and there's no way to socially isolate, 4 cases wouldn't just stop there, right? So it either means they're not testing or they're testing and they're not reporting. Do one or the other, do both. That's our sort of our push this week.
So Joby, a couple things to respond to that really quick. I want to just bring it back and center. Number one, I think the idea of this cultural reality that if you've done something wrong, you deserve what you get. I mean, that from a legislative policy perspective, that really is a cop-out, right? It's a cop-out to create a proactive, just policy system that addresses these issues and nuances of circumstances that are different for different types of people, right? People are born into situations they did not choose. So their choices after that will differ from the ones that you will choose. I'm talking about you, the person that may be assuming that you deserve what you get. So I think there is a failing of thinking outside the box and taking that extended responsibility to be more nuanced and not make it so simple. Categories make things simple for everybody. It's easier to digest. I think the other issue you bring up about why the governor is not reporting on testing, again, this goes into perhaps a narrative of political narratives of what is useful to share. How are citizens going to respond by saying, wait, you're saying there's already not enough tests and you're wasting tests on prisoners? Okay, so to get ahead of that would in turn create that humanity narrative that we know citizens need to see. And legislators, I don't blame the legislators for taking that route unless they take that route because they actually believe that, right? So these political decisions, it's kind of like what comes first, the chicken or the egg? Like if the legislator says, and as we know, these are all humans, we also want to tell you, we're also testing this area and just get it out there. People start viewing people differently and they say, oh, that's right. We never thought about that. What about people that were wrongly convicted? What about people that were children of individuals that were already not coming from a stable background? What about people that had mental health issues? What about them? Right? So you teach a community in that way if the legislator takes that approach. So I think there's room for that, and I hope that people take advantage of that. But I think what's very powerful, Nasir, about what you shared, and I want to be so thankful for sharing that, is that Nasir gave a window to the audience and to all of us who don't know of how it feels to be seen as an ex-violent offender and what that means and how that person evolves. A lot of the times I feel like people are put in these situations and they evolve into a better human being than all of us on the outside, right? So for example, Maryam, you said that a lot of your peers say they're some of the nicest people. Some of them are rude, 1 or 2. How many people on the outside are rude? How many rude patients do you get? And you can actually say 1 or 2 are rude, So I feel like individuals that have been given certain circumstances evolve, personally developed at such a faster rate because of the environment they're in, that when they come up and they come out like people like Nasir, who are on the forefront of these issues, who want to make it better for other people, who did not give up and actually study law. I mean, I'm a lawyer. I can't imagine how it would be to say, you know what, I'm going to make this situation work for myself. I'm going to just study law and I'm going to get degrees, and it's going to be in this, you know, concrete area with hardly any interaction with humans, and I'm going to make it happen. That kind of champion spirit, what that brings to the society wider is huge, and what a loss we are for not to recognize that. So really quick now to close up, and I want to thank you so much for your participation, is that the whole process of having these conversations is to, number one, highlight the issue, educate people, right? And then we have to be able to move forward. We have to be able to provide concrete solutions to everyday citizens, how we can make a difference. So I'm going to start off with Joby. If you can give us 2 to 3 calls to action, and I would ask the same for the other panelists as well. Go ahead, Joby.
Great. Well, we've been working really hard to create easy ways for people to participate. The first thing I would say is if you have a loved one who's incarcerated right now and you're in communication with them at all, we have a page on our website just for friends and family at www.restorejustice.org. In the About section, you'll see Friends and Family, and or if you follow us on social media, Restore Justice Foundation or Restore Justice Illinois, you'll find us. The Friends and Family page has a tracker on it where you can report things you're hearing from your loved one, and we aggregate those reports, and it makes it really powerful to say, you know, we're really tracking what's happening across the system and holding the Department of Corrections accountable. So that's one thing you can do. If you don't have a loved one who's incarcerated and you just want to be part of this movement, one thing you'll also find on our website is an action alert to write your legislator and let them know that you care about transparency in prisons. And we have a system that you can just put your name and address in, and it'll find your legislator for you and write to them. And then the third thing, be to take care of yourself, slow down, listen. I mean, I've been having a hard time with it. We all are. And none of us are going to be good for anything if we're a mess ourselves. So I, you know, listen to the doctors. Don't listen to the people who aren't doctors telling you what to do. And I think we'll all get through this okay. Thank you.
Thank you. Maryam.
Yeah, thank you. So I just want to say real quick, thank you for Brother Nasir for sharing his story. And I'm sorry, you know, from a physician standpoint that somebody had treated you that way. And so the one, I guess, leaving remarks with what I was saying earlier is that I think one thing that would be really helpful for people to do, same way like Joby was saying, to write your legislators, is to reach out to your legislators about increasing testing to get that. There are tests that we do have, and the administration has the ability to expand the Defense Production Act, the DPA, to get more testing done. And so I think whenever you have a system where you have limited resources, those categories that we were talking about become highlighted. But if you have enough of a resource, then you can actually start seeing people as people instead of your competition. And so just really, I mean, honestly, at this point, beyond anything else, testing and PPE as well, too. And the final point, I think, just to leave with people is that, you know, there were multiple studies that were done through the Robert Wood Johnson Foundation, through different insurance companies as well, too, that zip code actually has a huge part to play in your health outcomes. And you can extrapolate that to education, to even prison, school to prison pipelines, to your incarceration rates. And so I think just recognizing that it's not about the genetics of someone. The reason we have health disparities is not because someone is black or brown and white. It's because of where they live and what we allow to happen in our societies and what we don't allow. And I think if we just keep that in mind, that it's zip code and not who you are all the time and not your genetics, maybe that might help change things a little bit. So thank you so much, Maria, for the opportunity.
Thank you. Thank you, Maryam. Nasir.
Once again, I have to thank you, Mario. We've been working together now for a while now. And I hate that we didn't allude to SR 98 in regards to that lawsuit, healthcare situation about the Department of Corrections. Unfortunately, we didn't get a chance to go into that. But yes, I have to say, just get involved more now than ever. We're using social media more now than ever. I think it's brilliant. I'm still learning about the technology since I've been home. But man, it's brilliant. We can reach out and we can actually speak to one another. I'm getting more and more accustomed to Zoom and webinars, and It's like, it's brilliant. I've been accustomed to FaceTime my first day home. My daughter made it clear. FaceTime, 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 yeah. But you have to get involved. I would say definitely get involved with Parole Illinois' website. They are on the forefront. They're new, they're up and coming. They are heavily involved with families and friends of the incarcerated. Please log into emancentral.org. Tap on to the organizing tab. Get involved with what we're doing. Get involved. Do not be complacent. I have to say, we all have redeemable value. We are not irredeemable. It's sad on the human race if we feel like that we're irredeemable. It's sad. So we all have redeemable value. To incarcerate someone for natural life, saying they're irredeemable, I bear witness that's wrong. You're looking at someone. When I was first incarcerated, I did not have a release date. I was not coming home, but I'm home. So what does that say about the one that created all that is seen and unseen? It's sad on the human race if we're saying that we don't have irredeemable value.
Thank you, Nasir. I was thinking of, before this broadcast, like I was thinking of, okay, I have to write down my little black book, how I'm going to do the intro and then facilitate and conclude. And I don't have to do any conclusion after your words. So thank you so much to all of you. I'm going to include the links when we share this conversation. For whoever did not attend, what's great about technology is that we're going to reshare this conversation. I'll share it with all of you, share it with your communities, and continue this conversation, and we'll also revisit it. In addition, I do want to highlight, this is a golden opportunity. I always tell people during this phenomenon, and I don't call it anything else except that, because phenomenon can have negative and positive results, is that everybody is forced to pay attention to something. And so this is our opportunity to have people pay attention, because they're stopped from their busy lives. They're not commuting, they're not driving, they're in front of a screen, and we can reach them. So I'm very, very hopeful, I'm optimistic, and I'm so grateful for all of you joining me this afternoon. And I hope you guys have a great, great Sunday. Thank you. Thank you.
Thank you very much for having us.
Thank you.
Thank you. All right, I'm going to end now.